Number one value is integrity. Always do the right thing. What comes with that is safety. People are afraid, rightly so in many instances, and they need to be safe. Coming to our clinics, there is no safer place to be treated.
There has been very much a focus on what can we give, what can we do to make this the best experience possible, the safest experience possible for people. All those changes that we go through, we're focused on putting patients first. Not only does it keep them safe, it keeps our staff safe.
When COVID-19, when the sort of pandemic hit, we immediately moved to curbside care. We were actually treating patients outside in a safe environment, obviously, but a difficult environment. And so what we determined is that we knew we would ultimately have to get the care back inside, but get it back inside safely. So that's why we made a multi-million-dollar investment in our clinics to provide that safe environment, provide that care.
Some of the things that have been done are e-registration. It's an opportunity to register electronically and maintain distancing. And then once people come into the clinic-wide, we have enhanced air exchange systems where we're turning over air 6 to 7 times an hour. Enhanced air exchange is really important in our clinics. With ionic filtration, the particles in the air are treated in a way that enhance the ability to pull those particles out of the air, and so the air comes out even cleaner on the other side than it would with regular filtration. And as we do that too, we're treating it with UV light to clean that air. What we've done is in our common areas in the clinic, we have a UV light scrubber that is constantly circulating air and treating that air with UV light, so any virus that's present is killed. We have very high air turnover in the vestibule. It's about 20 times per hour that air gets turned over. So every 3 minutes, we're completely exchanging the air. In our exam rooms, we have installed UV lights that are used to sterilize the air and surfaces in those rooms after patient interactions. And so what happens is, after our team has left using those lights in the rooms, we effectively clean surfaces, air, and everything after people have been in those rooms. We know that during this pandemic, there's been some level of concern about, am I safe going into a healthcare facility? Everything that has been decided, from the air exchange to the filtration to the UV lights to the personal protective equipment that we wear, all these things are because we care about people. We want them to be safe, and we want them to know that when they come into the clinic, that they're going to be safe doing that.
We worked with a specialized engineering firm and honestly with my medical leadership who have really dug into the specifics of making sure that we are the safest urgent care. Our purpose at Physicians Immediate Care is remarkable care you can count on when and where you need it. There is no safer place to be treated.